There is a collaboration between Blue Cross Blue Shield of Michigan and the University of Michigan that measures anesthesia, and it's called Aspire. And our group, our anesthesia group in Battle Creek, leads in most every category, not just second or third, but number one. And this includes hospitals outside of Michigan, such as Duke, Mayo Clinic, Cleveland Clinic, UCLA, and we're at the top. So what you can be assured of is that you're getting top-notch care, world-class care at this small community hospital. We have an anesthesiologist and a nurse anesthetist in-house on call 24/7. This means that if you require the immediate services of an anesthesiologist, such as for a labor epidural, an emergency C-section, an emergency that comes through the emergency room, you have immediate attention from an anesthesiologist and a nurse anesthetist. We go to the emergency room when you have a fractured hip or fractured ribs. So there are very, very, very few anesthesia groups that are willing to do that in the country, probably just a handful of them. For a fractured hip patient, we do a fascial block that is a continuous block that can stay in for 5 days. By using this nerve block, we are reducing the amount of narcotics that these patients are getting. They're elderly. Well, how do they respond to narcotics? With delirium and dementia. So they have less delirium, less dementia. They actually did a study on our nerve block techniques and found that we decreased their length of stay by over a day and reduced their cost by over $5,000. Much less complications. We don't see deaths in the hospital from hip fractures, and that is a common event across the country. And that's largely due to getting on top of it as soon as they come through our ER doors. You have a physician anesthesiologist supervising and working in a collaborative fashion with highly trained nurse anesthetists. So if you have a patient with multiple medical problems, the physician anesthesiologist can address the interactions with their medications and with those healthcare needs to make sure that they get the best anesthetic plan for their particular needs. And then the anesthetists deliver that plan in a highly qualified manner. We are the only hospital in Calhoun County that has physician anesthesiologists. That's the difference. That's why you need to come to Bronson Battle Creek.